020 7862 2222. This is the new plan from Labour, which they hope will help tackle the NHS waiting list. Family doctors in England will receive a £20 bonus if they avoid referring their patient to hospital. So avoid referring. That's the key thing. And instead send them to a community-based specialist. Ministers say around 2 million people a year are being sent to hospitals where they could be tested and treated elsewhere for common conditions such as tinnitus, earwax and IBS. They hope it will rewire the NHS and allow patients to be treated closer to home. The plan is backed by the British Medical Association. What do you think of it?
I think, look, there's a few things. Ultimately, nothing is ideal at the moment in this country. We had 14 years of the Conservatives, destroying most things, including the NHS, so I'm going to say it.
Yeah, go ahead.
Nothing's going to be ideal. Do I think this is ideal? Of course I don't think it's ideal. However, people in this country want those waiting lists to come down. And so this is a way that can happen. Now, what is really important in this is that you've got the right safeguards in place. And what this needs to be about is making sure that actually patients get the best care. And sometimes we know the best care isn't going into hospital. I've got a damaged leg at the moment. I'm going to be sent. Yeah, I've pulled my calf playing football. Unfortunately, you can't see it, but it's
it's not moving.
It's moving, but I can't run, I can't dance, can't jump. It's upsetting, but I'm okay.
Oh, I'm sorry. Have you been to the doctor about that?
I have been to the doctor, and the
Why
point
though?
is
Because it's not going to. Well, I'm not medically trained, but if I'm a doctor, I just say, look, you'll be fine after a few months. Just.
Well, January 20th. January 20th is when I did the injury.
Really?
Yeah.
Okay. So what? So you're on a consultant thing then?
So then they send you into like a kind of community-based physio, like rehab place. So it's much better than me being put off to the hospital.
Yeah.
And this is what we're talking about. We're talking about people getting the best care, the efficient care, and making sure that those alternatives are being used. What this isn't about is saying to someone, oh, you need to go to hospital, we're not going to send you there, so this guy can get 20. That's not what this is about.
What do you think, Christian?
Yeah, I mean, I'm concerned about it. I don't understand why there needs to be a financial incentive to GPs to do this. Surely everyone recognises that it's probably not the best to have absolutely everyone going to hospital. So I'm concerned about the money aspect because I think it might produce some slightly perverse incentives in the medical system. But I'm always also slightly confused because GPs are already quite limited when it comes to sending people to hospital. I was watching a very interesting, by complete coincidence, TikTok, I think it was, by a GP who is explaining that, for example, even if someone has an obvious eating disorder, they can't be referred to an anorexia clinic until they go below a certain BMI. Now, that seems absurd because you think you want to deal with these before you get below that BMI so you can actually reduce the pressures on the NHS. So I think there's a slight element of grubbiness about the money aspect, and I can see it potentially inadvertently leading to problems. Actually, I think there is a bit of a problem. I find it frustrating when I go to a GP and I get the sense that something could be done, but because it might cost a bit more money, they want to drag out the process for a few months and have me try all the different pills and all the different options before we get to the obvious conclusion. And that's the sort of reason why some people go private, because you skip out that inefficiency.
Yeah. What about earwax? There's one. I had some earwax removal the other day because I got off a flight. I couldn't hear anything. I thought maybe some earwax had shifted. It turned out, actually, interestingly, I'd been wearing an earphone, which is airtight, and they said if you do that in a flight, your ear can explode. You never do it because the air pressure difference between inside and outside. So I was very lucky it was okay. Anyway, did I go to the GP to ask about earwax removal? No, because I've heard that they can't do it anymore.
Well, interestingly, at our GP, we used to have a specialist in that, and you would clear it out, which is
for free.
It's actually very therapeutic, isn't it?
No, yes, it is. So now and apparently you put it on TikTok, it goes crazy.
Oh, okay. I didn't put it on TikTok.
Everyone on TikTok just wants to see other people's earwax. Yeah,
that's another point. It feels to me over the past 15 years we've actively been moving things out of GP surgeries. You say like earwax removal. I think like verruca services, they've also been moved to hospitals. I mean, I don't think that was particularly efficient. I think people prefer going to the GP than going to hospital in the first place.
I mean, in the end, I paid a guy £100 to take my earwax out. It's expensive. A lot of people have to do that. So there's the example. I didn't go to a GP. I just went private and it was one guy and he just did it in half an hour and that was it. And he gave me a hearing test as well. But the thing is, the NHS has got to be able to get you to that service free.
Yeah.
So therefore, it's got to set it up.
Yeah.
So therefore, you end up with lots of earwax removal people all around the country.
Yeah.
And it's very expensive.
Yeah, it is. And the point is we want to get to this place where, you don't have these incredible long waiting lists. The point here is there are alternatives. It's not going to happen overnight. But the fact is, lots of people don't want to rock up at the hospital like inconvenient times, travelling far for possibly something that could be done more locally to them with a specialist.
OK, let's see. Jennifer in North Yorkshire. How's your health, Jennifer, at the moment?
It's okay at the moment, thank you.
Good. Have you had this situation where the GP says, I'm sending you to hospital, and you think, I don't think it really needs a consultant?
No, I just think it's going to gatekeep in a sense. It's going to maybe prevent people from having the correct procedures because they might miss things, etc. I think there's a bit of a hidden agenda there. But my experience 4 years ago, I had an acute appendicitis as COVID broke out over the New Year period. New Year's Eve, New Year's Day. So obviously didn't go to the doctors because I couldn't. Everything was closed. Yeah. The day after I did, and the GP said, oh, no, it's nothing serious. It's IBS. I'll prescribe peppermint pills, which he did. Several hours later, by the end of the day, I was in such a state, I ended up going to A&E and I was in hospital for 8 days. I had a hole in the bowel, gangrene, nearly died. I was the first on the list for the op next day. Whether the GP was inept, made a mistake or whatever, I don't know. But I just feel that, rewarding people for keeping them out of the system.
Well, that's certainly, that's a very good point. If you make a wrong call on stomach pain or headache, actually, so a headache, most times it's migraine or it's a normal headache. Sometimes it's a brain hemorrhage. Sometimes.
And I think I've often got a problem with the way that healthcare is done in this country because it feels like GPs, but also the way we are told to live our lives, whether it be on smoking, whether it be on, unhealthy foods, it's so often framed around doing what the NHS can afford to save money for the NHS. And I just think morally it's sort of wrong to ask people and GPs to live their lives or do their jobs to help the health service rather than for themselves. And I think, GPs should prescribe the medicine that is needed by the patient. They shouldn't skimp on recommendations and referrals to consultants because the NHS is struggling. If the NHS is struggling, it needs reform. We shouldn't get worse services.
Thanks, Jennifer. I'm glad you're OK. Katie in Lancashire, hi.
Yeah.
Hello, what do you think this thing of £20 for a GP if he sends you somewhere other than a hospital?
Well, I think GPs should get it. I think that, they work really hard, and I think the NHS is up in the air a lot because the hospitals now refer lots of people back to GPs. You've got weeks to wait. They run out of medicine. They ask the GP to do it. So, to do the prescriptions.
Yeah.
And someone was talking about the self-referral. Well, that's a really good idea in principle, but in practice, somebody only has to have a bad knee for a week and they can self-refer, so it clogs up all the system.
Yeah. They had a sort of online thing called GP at Hand, which I signed up for. And you could just get booked to see a GP and they would appear on your phone 2 hours later. It was amazing.
Was that the private one?
No, it's the NHS, yeah.
Oh, right.
Is it still going?
Well, here's what happened. It suddenly became really difficult to book the doctors.
Yeah.
And you had to go through a triage, and I tried to get in touch with them and said, what's gone on? And in the end, I called them, and a very helpful person said, look, to be frank, if you offer a GP free to anyone for anything at any time, the whole country's calling you.
Yeah.
We just
They got
collapsed.
overwhelmed.
Yeah, they got over because a lot of people are time wasters.
But the idea with this is that actually it should be people getting the best treatment in the best way, and recognising that isn't always going to the hospital, and actually there are specialist services in your community. So actually this should be about getting patients the best care.
OK, thank you, Katie. Later, it's the papers and everything.